Introduction. Eczema or dermatitis is a group of inflammatory skin diseases provoked by a wide variety of stimuli, i.e. direct injury from toxic chemicals, mechanical trauma and immunological reactions. The terms dermatitis and eczema are often used as synonyms. The term eczema derives from the Greek word meaning to boil. Eczema describes a clinical and histological pattern, which can be acute or chronic and has several causes.
The clinical morphology of eczema. Acute. Erythema, edema, usually typically ill-defined. Papules, vesicles and occasionally bullae. Exudation, fissuring, scaling. Chronic. May be as above but less edema, vesiculation and exudate. Lichenification. Skin thickening with pronounced skin markings, secondary to chronic rubbing and scratching. Fissures, excoriations. Dyspigmentation. Hyper and hypopigmentation can occur. Classification of dermatitis. Endogenous dermatitis. Seborrheic dermatitis. Atopic dermatitis. Exogenous dermatitis. Irritant. Allergic. Photoallergic. Chronic actinic dermatitis. Characteristic patterns and morphology. Asterotic. Discoid. Gravitational. Lichen simplex. Pompholyx. Atopic dermatitis. Atopic dermatitis. Atopic eczema is a common endogenous form of dermatitis and usually begins in childhood. It is an itchy, chronic and relapsing dermatitis. Pathogenesis. Generalized prolonged hypersensitivity to common environmental antigens, such as pollen and house dust mite, is the hallmark of atopy, in which there is a genetic predisposition to produce excess IgA. Atopic individuals manifest one or more of a group of diseases that includes asthma, hay fever, food and other allergies, and atopic eczema. Genetic factors play an important role in all of these conditions, supported by higher concordance of atopic disease in monozygotic twins compared with dizygotic twins. Decreased skin barrier function may also allow greater penetration of allergens through the epidermis, and thus cause immune stimulation and subsequent inflammation. The interaction between genes and environment is important. It has been estimated that 60–80% of individuals are genetically susceptible to the induction of IgA-mediated sensitization to environmental allergens such as food and animal hair. Eczema is characterized by infiltration of THR2 cells, which are known to play a role in activating mast cells and eosinophils, as well as stimulating IgA production by IgA-producing B cells. Thus, the pathogenesis of atopic eczema is complex and multifactorial, involving an interplay of contributing factors. Clinical features, distribution and character of rash. Atopic eczema is extremely itchy and scratching accounts for many of the signs. Widespread cutaneous dryness, also known as xeroderma or xerosis, is another feature. Babies and infants. Often acute and facial involvement prominent. Trunk involved but nappy area usually spared. Children. Flexures, behind knees, antecubital foci, wrists and ankles. Adults. Face and trunk usually involved, limb involvement not restricted to flexures. Lichenification common.
Atopic dermatitis, infantile eczema.
Diagnostic criteria for atopic eczema. Itchy skin rash, or history of itch or rubbing from parent, and at least 3 of the following. History of involvement of skin creases or cheeks if less than 4 years. History of atopic disease, asthma, hay fever, or in a first degree relative if less than 4 years. Dry skin xeroderma. Visible flexural eczema, cheeks, forehead, outer limbs if less than 4 years. Onset in first 2 years of life. Seborrheic eczema. This is an erythematous scaly rash affecting the scalp, dandruff, central face, nasolabial folds, eyebrows, central chest and upper back. It is associated with, and may be due to, overgrowth of Malassezia yeasts. When severe, it may resemble psoriasis. Treatment often needs to be repeated due to disease recurrence. Seborrheic eczema.
Discoid eczema. Discoid eczema, which is also known as nummular eczema, is common and characteristically consists of discrete, coin-shaped eczematous lesions, which are often impetiginized and most commonly occur on the limbs of men. It is an eczema type that can be due to any chronic itchy condition, whether primarily of the skin or secondary to an underlying disease. Discoid eczema. Irritant eczema. Detergents, alkalis, acids, solvents and abrasives are common irritants. Strong irritants have acute effects, whereas weaker irritants commonly cause chronic eczema, especially of the hands, after prolonged exposure. Individual susceptibility varies and the elderly, atopic and fair-skinned are predisposed. Irritant eczema accounts for most occupational cases of eczema and is a significant cause of time off work. Irritant avoidance, including protective clothing, such as gloves, is essential. Emollients are indicated. Irritant eczema. Allergic contact eczema. This occurs due to a delayed hypersensitivity reaction following contact with antigens or haptens. Previous allergen exposure is required for sensitization and the reaction is specific to the allergen or closely related chemicals. Allergy persists indefinitely and eczema occurs at sites of allergen contact and can secondarily spread beyond this. Allergen avoidance is key and may involve a change of occupation, recreational activities or hobbies. The distribution of eczema can be very informative with regard to possible culprits. There are many recognizable patterns of sites of eczema involvement, such as earlobes, wrists and umbilicus due to contact with nickel in earrings, watches and jeans studs. Hands and wrists due to rubber gloves. Edema may also be a feature. Treatment with emollients and topical glucocorticoids helps but will not soothe if there is continued allergen exposure. Common type 4 delayed hypersensitivity allergens. Allergen. Source. Nickel. Jewelry. Jean studs, watches. Dichromate. Cement. Leather. Matches. Rubber chemicals. Clothing. Shoes. Rubber gloves. Tires. Paraphenylenediamine. Hair dye. Clothing. Tattoos. Balsam of Peru. Perfumes. Citrus fruits. Shower bath products. Neomycin. Benzocaine. Topical medications. Parabens. Preservative in cosmetics and creams. Methylene. Chloromethylacethiazolinone. Preservatives, with increasing numbers of cases of allergy reported. Allergic contact eczema. This was caused by the application of an antihistamine cream. The acute eczematis reaction and bilateral periorbital edema are typical. ASTEATOTIC eczema. This occurs in dry skin and is common in the elderly. Low humidity caused by central heating, overwashing, diuretics and cholesterol-lowering drugs predispose. The most common site is the lower legs, and a crazy paving pattern of fine fissuring on an erythematous background is seen. ASTEATOTIC eczema. Gravitational eczema. Gravitational or stasis eczema occurs on the lower legs and is often associated with signs of venous insufficiency, edema, loss of hair, induration, lipodermatosclerosis and ulceration. Emollients should be used and topical glucocorticoids should be applied to eczematous areas but not to ulcers. There is a high risk of sensitization to topical preservatives, such as chlorocresol, antibiotics, such as neomycin, and bandages, such as rubber additives. Edema and ulceration are treated by leg elevation and compression bandages. Gravitational eczema. Lichen simplex. Lichenification of eczema occurs secondary to chronic rubbing and scratching, and lichen simplex is a localized form. Common sites include the neck, lower legs and anogenital region. Lichen simplex. Pompholyx. Intensely itchy vesicles and bulli occur on the palms, palmar surface and sides of the fingers and soles. Pompholyx may have several causes, which include atopic eczema, irritant and contact allergic dermatitis and fungal infection. The underlying cause must be treated or removed. Pompholyx. Investigations for dermatitis. Bacterial and viral swabs for microscopy and culture are important in suspected secondary infection. Bacterial swabs are commonly positive, particularly for staphylococci, although clinical assessment is required in order to ascertain whether swab results are of clinical significance and whether antibiotic treatment is required. Individuals with atopic eczema have an increased susceptibility to herpes simplex virus (HSV) and are at risk of developing a widespread infection, eczema herpeticum. The presence of small, punched-out lesions on a background of worsening eczema suggests the possibility of secondary HSV infection. Skin scrapings to rule out secondary fungal infection should also be considered. Total IgE and specific IgE tests and skin prick tests are not routinely undertaken in atopic eczema as they are not usually helpful, although they may occasionally be indicated in some cases as directed by the history. Patch tests should be performed if contact allergic dermatitis is suspected. Skin biopsy is not usually required unless there is diagnostic doubt. Management. General management. Apply coconut oil or petroleum jelly for relief of itching in dry eczema. A general approach to the management of eczema includes advice, education and support, required for patients with eczema of any type. Allopathic management. Emollients and topical glucocorticoids are mainstays of treatment for all eczema types, in order to improve skin barrier function, limit transepidermal water loss and reduce inflammation. Emollients can be used as bath additives and soap substitutes, and applied directly to the skin, often combined with antiseptics. Sulfur. Skin. Dry, scaly, unhealthy, every little injury suppurates. Freckles. Itching, burning, worse scratching and washing. Pimply eruption, pustules, raggeds, hangnails. Excoriation, especially in folds lycae. Feeling of a band around bones. Skin affections after. Local medication. Pruritus, especially from warmth, is evening, often recurs in springtime, in damp weather. Modalities. Worse, at rest, when standing, warmth in bed, washing, bathing, in morning, 11 a.m., night, from alcoholic stimulants, periodically. Better, dry, warm weather, lying on right side, from drawing up affected limbs. PSORINUM. Skin. Dirty, dingy look. Dry, lusterless, rough hair. Intolerable itching. Herpetic eruptions, especially on scalp and bends of joints with itching, worse, from warmth of bed. Enlarged glands. Sebaceous glands secrete excessively, oily skin. Indolent ulcers, slow to heal. Eczema behind ears. Crusty eruptions all over. Urticaria after every exertion. Pustules near fingernails. Modalities. Worse, coffee. PSORINUM patient does not improve while using coffee. Worse, changes of weather, in hot sunshine, from cold. Dread of least cold air or draft. Better, heat, warm clothing, even in summer. MEZEREUM. Skin. Eczema, intolerable itching, chilliness with pruritus, worse in bed. Ulcers itch and burn, surrounded by vesicles and shining, fiery red areola. Zona, with burning pain. Bones, especially long bones, inflamed and swollen, caries, exostosis, pain worse night, touch, damp weather, murk, sif. Eruptions ulcerate and form thick scabs under purulent matter exudes chrysophanic acid. Modalities. Worse, cold air, night, evening until midnight, warm food, touch, motion. Better, open air. DULCAMARA. Skin. Adenitis. Pruritus, always worse in cold, wet weather. Herpes zoster, pemphigus. Swelling and indurated glands from cold. Vesicular. Eruptions. Sensitive bleeding ulcers. Little boils. Red spots, urticaria, brought on by exposure, or sour stomach. Humid eruptions on face, genitals, hands, etc. Warts, large, smooth, on face and palmar surface of hands. Anasarca. Thick, brown-yellow crusts, bleeding when scratched. Modalities. Worse, at night, from cold in general, damp, rainy weather. Better, from moving about, external warmth. Petroleum. Skin. Itching at night. Chilblains, moist, itch and burn. Bed sores. Skin dry, constricted, very sensitive, rough and cracked, leathery. Herpes. Slightest scratch makes skin suppurate, pepper. Intertrigo. Psoriasis of hands. Thick, greenish crusts, burning and itching, redness, raw, cracks bleed easily. Eczema. Raggeds worse in winter. Modalities. Worse, dampness, before and during a thunderstorm, from riding in cars, passive motion, in winter, eating, from mental states. Better, warm air, lying with head high, dry weather.